Hi, I'm Dr. Noelle Lucas, and I work at Blue Oasis Pet Hospital, and I am here to answer some questions about cat cardiology and some concerns or questions that pet owners may have. I have an assistant who's going to ask me some questions that you have wrote in.
Dr. Lucas, what are some heart problems cats can encounter?
Yeah, so cats have little hearts just like us, and they can actually have some very similar heart diseases as you and I. Cats can have valvular disease, so their valves may be a little leaky and cause murmurs. They can have thickness in their hearts that causes their hearts to become hypertrophied, which means enlarged. And they can also have electrical issues with their hearts, which you and I know as arrhythmias. So cats actually can have a very wide variety of cardiac disease.
How do heart issues impact the health and well-being of a cat?
Well, the heart is the pump, and it's circulating all the blood that we need to keep our little patients alive. So if the heart either is having some leakage, if it's getting thickened, or it's having an arrhythmic beat, those can present as abnormal symptoms in your pet. And we're going to talk maybe about some of those symptoms that your pet may have.
What preventive measures do veterinarians recommend to help to avoid feline cardiology issues?
How to prevent heart disease in cats. So unfortunately, cats naturally have some genetics built into them that predispose them, just like you and I, to feline or cat heart disease. One of those being hypertrophic cardiomyopathy, which is a genetic disorder of cats' hearts. But we do know that when they eat their food, they actually need to have taurine added to their food because they don't make it on their own. So cats are required to have taurine in their diets.
What are some signs and symptoms of cat heart issues, and what can they really cause?
Yeah, so those goes back to those symptoms of heart disease in cats. Cats can have very hidden symptoms of heart disease, so hidden that sometimes a cat with underlying heart disease can have sudden death as its first clinical symptom of disease. So that cannot be overstated, that it's important for your cat to come see their veterinarian routinely so that we can look for, listen, and maybe do some screening on their heart because of that known clinical symptom of sudden death in cats with underlying heart disease. However, if your cat does have heart disease and does show some symptoms of having an abnormal heart, because cats are so sedentary, sometimes it goes unnoticed, but just more lethargic or just, we call it just ain't doing right. So being more reclusive, wanting to just like sit around more, maybe having some increased respiratory effort and rate, so just breathing in a different way. Those would be some subtle sort of first signs of heart disease. Some later symptoms, maybe a cat might open their mouth to breathe. So open mouth breathing in a cat is extremely rare, but it can indicate some underlying heart disease. Those were coughing, I guess, is on the list, but we don't see a lot of cats coming in with coughing that are related to heart disease. It's usually more lung disease, but coughing would be on the list as well.
So what's the processes in the workup that you would get if you were bringing a cat?
Yeah. So what do we do when we're assessing your cat's heart? Well, number one, we're going to listen with our stethoscope, listen to where their heart sounds. Is it beating normally? Is there abnormal beats that we hear? Can we hear their heart valves closing normally, or they have a murmur? So those are some of the things that we listen for just on a normal physical exam. We also recommend, starting usually even at about 1 year of age in a cat, we actually do some just wellness blood work. And on that blood work, there's actually a cardiac enzyme that we are measuring now for cats, because we know 1 out of 6 cats historically have heart disease, and even at a very young age. Again, genetics plays a role, so young cats can have heart disease. Males are more predisposed than female cats to getting this genetic early age heart disease. So we actually will draw some blood on your cat. When we send it to the lab, we're actually measuring a cardiac health enzyme to see if your cat's having any abnormal stress or stretch on its heart muscle. So we're looking for those underlying little clinical biomarkers that can help predict if your cat actually is one of those pets that may be predisposed to getting some heart-related disease as they continue to age.
Why is it important to avoid self-diagnosing heart problems in your cat?
Yeah, so cats, again, are very secretive about their disease processes in general. If you feel that your cat is not doing well for whatever reason, it's really important that you get them in to see your veterinarian so that we can actually just do a good physical exam, maybe some blood work, maybe we're going to do some chest x-rays. Heart disease in a cat can progress all the way to where they have some fluid, maybe even filling up in their around their lungs. And the only symptom that you might know is, hey, my cat might be breathing a little differently, but they can be in very serious distress and maybe even life-threatening disease. So it's very important that you bring your cat in for your doctor to do a physical exam. Don't try to self-diagnose heart disease because it is actually incredibly important that we diagnose it correctly and early so that we're able to intervene and hopefully save your cat's life, or at least give them a chance to live a little bit longer, healthier life with heart disease. So
let's double down on early diagnosis.
Yeah.
How important is early diagnosis towards cat cardiology health?
Yeah, so if we detect one of those cats that has an abnormal cardiac enzyme, it's called a proBNP, then we're able to maybe recommend some additional testing such as chest x-rays or an ultrasound, and that's the way we actually truly diagnose the heart disease, is with an ultrasound or an echo. And once we have that diagnosis, then we're able to better guide the treatment or prevention. So do we need a special diet? Is there medication that we might need? We might want to check your cat's blood pressure so we can see if they have any hypertension related to their heart disease. So we have a lot of tools to diagnose heart disease, and we also have some real interventive medicine that we can do to help your cat live a longer, happier life. So if you have any questions about your cat's heart or feline cardiology, we invite you to talk with your veterinarian, and here at Blue Oasis Pet Hospital, we would love to see your cat. Thanks.